Hello, I am Dr. Debadeep Chakravarty. I am an oral and maxillofacial surgeon attached to Peerless Hospital. And today I am going to discuss about oral ulcers, oral cancers, and their prevention, diagnosis, and the treatment of these diseases. So, as you would know that oral cancer is the commonest cancer in the Indian subcontinent, and we have the most number of addicted people in the oral cancer region. And the main cause is smoking, pan parag, gutka, pan chewing, supari chewing, and all these things combined has made us the oral cancer capital of the world. So, for a lay person, how would you prevent or diagnose whether you have a problem which can lead to cancer in the future? So, self-diagnosis is most important in these things. So, you have to, when you brush or you are cleaning your mouth, you must always observe if you have any white patches or whether you have any red areas or any ulcerations in the mouth. And if any ulcers or any patches which don't go away spontaneously within the first 2 weeks of using a regular mouthwash or a over-the-counter gel, then you must see a dentist or a maxillofacial surgeon to get a diagnosis. So, and how is diagnosis achieved? The most commonest way is to do a biopsy. And most people get scared when they hear the term biopsy because they think it will lead to cancer. But I will tell you, the most of the cases where we do biopsy, it comes back as negative. But it is important to know that whether it is a pre-malignant or a malignant or whether it's just normal tissue, because then we can do the treatment plan accordingly. If by chance it comes back as malignant, if it comes back as cancer, oral cancer, so we can always treat it, and the smaller the cancer is, the better the prognosis. That means the better the outcome and the better the chances of survival for many years after the treatment. So, the biopsy is the first step. It normally takes only 15 to 20 minutes to do a biopsy, and it takes about 5 to 7 days to get a report, histopathological report, where the histopathologists will tell us what stage the condition is, and accordingly we can do a treatment. The commonest treatment is surgery, where we cut the area out with a wide margin. It is normally recommended to have a 1 centimeter margin around the disease, and then we have to do a neck dissection where we take out all the glands in the neck of that side, and sometimes if the disease is crossing the midline, we also do both sides. We take out the neck glands of both the sides, and this is a routine surgery these days. It's not a very critical surgery which it used to be 20 years back, because it is done and people have achieved the expertise to do this in very short time nowadays. The next comes the reconstruction, because if we do take out part of the tissue, it has to be replaced. So, it depends on what we are removing. If it is just soft tissue, we normally replace it with soft tissue from the cheek, or we can do a free flap from the arm or the thigh. Or if it is bone that we have to remove, part of the jawbone, then we can replace it with bone from the leg. And these free flaps, basically it is called a free flap because it comes with its own blood supply, and we plumb these vessels, vein and artery, to the vein and artery in the neck. And the outcome is very good, and it has a success rate of over 90% now, where it can be successfully rehabilitated, and later on the patient can have dentures or even fixed teeth on these areas and can have normal diet afterwards. But again, coming to the point, prevention is better than cure. So, I would urge you all to stop all your oral habits, including smoking and especially pan masala, gutka and tobacco chewing, because tobacco chewing, we all know about that it causes cancer, but people are very less aware about the bad effects of supari and pan masala, and we can see ads all over. Even our favorite cricket stars and film stars are doing ads, which is very unethical, I think, because it is encouraging the young generation to actually follow that. though it is always named with something else, but it is actually all branding. So avoid pan masala, avoid supari, avoid pan chewing at all costs. And if you have any ulcer or any redness in your mouth, please show a dentist or a maxillofacial surgeon. Thank you very much.
Peerless Hospital, restoring health.